Uh, Good evening and welcome to the last of the lectures in the series of workshop on basics of acupuncture. So today we'll be discussing the role of acupuncture in medical disorders as well as in the musculoskeletal pain syndromes and the various pathologies, some neurological conditions as well. And this has been brought to you in conjunction with MedTalks and IJCT, and I'm very thankful for them to have live stream this and provide us a platform for all these 14 days of the workshop. So I'll be starting first with the various medical disorders where acupuncture has been used successfully. One of the most commonest conditions where acupuncture has to be proven of benefit is bronchial asthma. Now, bronchial asthma is one condition when it is there, it is very debilitating. There are many medications which the patient is on, and that reduces the compliance and causes a lot of discomfort. Now, acupuncture in itself may not be able to cure the disease itself, but it definitely reduces the severity. So it can be used in conjunction with medications. Now, there have been various studies which have shown benefit with acupuncture. There have been studies which haven't shown any benefit. There has been a Cochrane review on it, which said that the quality of the studies which the authors had done, the Cochrane systematic database they had done, was not ideal enough to reach a conclusion. So the Cochrane review was inconclusive. So maybe that is one area where more studies and robust studies are required to actually find out the role of acupuncture. But yes, we all know that it reduces, right? And it reduces the activity of the granulocytes and histamine releasing cells. It stabilizes the membranes. So that is one of the roles of acupuncture. But definitely, if it is an allergic or if you know an allergen, that has to be removed for lasting relief. Just give me a minute, please. I think. Yeah. Okay. So bronchial asthma can be an acute attack, okay, which can be life-threatening. And sometimes we have seen that even the inhalers or medications does not help. For acute attacks of asthma, there are 2 points which are specifically helpful. One is, Yuri, take the point, please. So one point is REN 17. Where is it? कहाँ पे है REN 17? On the sternum, between the nipples, on the sternum, almost perpendicular to oblique insertion subcutaneously. So that is one of the very good points. Even if you don't have a needle, acupressure at this point will help. Okay. Yuri, take the point. So that is one point, right? The other important point is REN 17 is between the intermammary line on the sternum, and the other point is your REN 22. Where is REN 22? Where is REN 22? Suprasternal notch. So how do you needle it? First you go perpendicular and then you go posteriorly and inferiorly below the manubrium sternum. Okay. You have to be careful because you have got great vessels and you might actually cause pneumothorax. Okay. So you might cause damage, but yes, this point has shown to give instant relief. And again, this can be used as an acupressure point as well. Okay. Other points are Ding Chuan. So where is the Ding Chuan? Which Ding Chuans do you know? Which are the Ding Chuans do you know? There are two Dingchuans. Yes, just 0.5 shin lateral to C7 and T1. Bilaterally, you go perpendicular, right? 0.5 to 0.8 shin. And then the second Dingchuan is the anti-tragus. So again, you can use retention needles here. You can use normal needles here, half-inch needles, or again, pressure can be applied. You can just pinch your anti-tragus and instant relief is used. And instant relief can be attained, right? So these are for acute attack of asthma. Now, if you read your book, there will be many things. Now, asthma is propagated to be a multi-organ disease in Chinese traditional Chinese medicine, TCM. So it can be because of lung, it can be because of spleen, it can be because of kidney also. Okay, so whether the energy is low or high, so we won't go into that. But yes, acute we know, but for reduction of medications and stabilization of disease, since the pertaining organ is lung, the important points are lung 5. Where is lung 5? Elbow, just lateral to the tendon of the biceps femoris, right? Biceps brachii, sorry, not biceps femoris, biceps brachii. Okay. Then lung 9, which is the Yuan source point for lung channel. It can be used if lung 5 is inaccessible. Lung 9 is very good. Flexor carpi radialis. Okay, the palmar trees. Then lung 1 can be used if the limbs are inaccessible. That is the front view point of lung itself. Okay, where is lung 1? First intercostal space, right? Mid clavicular. Or 2. Lung 2, right? The other points, sorry, which confusion? The other points are UB12 and UB13. If the front points and the extremity points are not available, you can use UB12 or UB13. UB13 is the backshoe point for lung. Okay, so if the lung points on the extremities or anteriorly are not available, you can put UB13. UB12 is UB13, UB12 and UB13 are where? UV चैनल तो सबसे आसान है, बैक में होता है, कहाँ पे होता है? 12 is T2, 1.5 shun lateral to the midline. 13 is T3, 1.5 shun lateral, right? Dingchuan on the back, right? Or Dumo 14. Dumo 14 is T7. T7. Okay, so that's a dangerous point. You have to be careful. You have to puncture oblique and upwards. Okay, so these are the points. So if you're using back points, you can use the back points and you can use lung points as well anteriorly. So ancillary points which can be used are UB20, UB23, which is a splenic backshoe point for spleen. As I said, according to TCM, it's a multi-organ disease, right? So spleen, if you want to give spleen, use spleen, it is UB23, and Li4 and lung 7 can also be used. So if you're using the extremity points, lung 5, lung 7, and Li4, right? If you're using the back points, you have got the whole variety to choose from. Okay, Dumo 14, UB12, UB13, UB20, UB23, and Dingchuan in cases if you feel that the attack is severe enough. Now, sometimes asthma is also associated with a feeling of impacted secretions in the chest. Okay, they say that we can feel that something is stuck inside. We are coughing it out, but nothing is coming out. So in those cases, these points will help in addition to the primary points and the ancillary points. So you have the UB20, UB13 and UB12, lung 9, spleen 6. Now phlegm is basically, they say it is because of the spleen. So that is why splenic points help in asthma. And stomach 40. Stomach 40 is a good tonification point in the legs. Okay, so the choice of the points will depend on the primary pathology and the group that you're choosing or the patient is more comfortable. Okay, so this is about asthma. Now the group of, again, allergic disorders: sinusitis, rhinitis, tonsillitis, pharyngitis, and laryngitis. Okay, so this is all ENT related diseases. So in sinusitis, we all know acupuncture helps by increase of blood flow, increase phagocytic activity, pain relief, thinning, and early clearing of secretions. For frontal sinusitis, you can use GB14, Li4, Yintangus, extrameridial head and neck, and Li20. Where is Li20? Yes, aloe of the nose, lateral to the aloe of the nose. ठीक है, जब भी ज्यादा हो जाता है, secretion नहीं आती, what do? We do this ना, we do this. Okay, so EM1, GB14, आपके यहाँ पे जो extra meridian points हैं 2, 3, 4. Okay, so you normally do this. So you're simulating your acupuncture or acupressure points when you have frontal sinusitis. For maxillary sinusitis, it is stomach 2, just below the infraorbital notch. Infraorbital foramen, just below that, depression below that, and Li4. You can always add lung 7 and stomach 44 on the foot. Okay. So this is for maxillary sinusitis. So if you see, these are all local points. These are all local points for your sinusitis. For allergic rhinitis, again, Yintan. Okay. Li20. Dumo 23. Dumo 23 is one shun above the hairline. And Li4. You can use Dumo 14 and UB13 for refractory cases. Remember, these are the points which were used in asthma also. For allergic conditions, Dumo 14 and UB13 are helpful. Right? For headache, again, GB20 and GB14. Where is GB20? GB20 is just below the occipital. Needling is oblique towards the opposite eye. Okay. In the ear, for if you have got bronchospasm, obviously you can use the asthma points. Okay. You can use the internal nose, lung, and forehead on the ear. Stomach 36 and UB12 for prophylaxis. Now, stomach 36 again is a general tonification point. Okay. If you've got a generalized allergy, urticaria, spleen 10, spleen 6, liver 2. Liver 2 is, where does the liver channel start from? Stomach 36, Li11, and GB34. You can use the endocrine point on the ear. You can use the adrenal point and the lung point. Right? In acute infection, you can add Dumo 14, Sanjay 5, UB11, and Li4 for acute infection. Now, if you see, most of these points are where your acupressure will also work. Okay. However, you have to rule out your DNS and nasal polyps because, as we had said before, that if there is a resectable cause or an underlying cause, unless that is removed, your acupuncture won't be that much of beneficial. Right? So the thing is, you cannot treat acute bacterial infection with acupuncture. But yes, the response of the body, that can be regulated. So you antihistaminics and decongestants use can be reduced or minimized. But if there's an acute infection, antibiotics may need to be given, right? For tonsillitis, you've got SI17, LI4, stomach 36, stomach 6, stomach 44, and lung 7. And you can have the ear tonsil point. Where is the ear tonsil? Below the eye point. So lobule, just center of the lobule, below that. Okay. For pharyngitis, again, the irritant has to be removed first. You can't say I'll keep on smoking cigarettes or weeding and I want acupuncture to cure my pharyngitis. Right? Anand, dekhiye. Has anyone seen Anand? The opening scene of Anand, 70s movie. No, you must watch it. As medicals, you must watch it. Watch that movie. Okay. So Amitabh Bachchan and Asit Singh. So that is a very relevant scene. So this is Asit Singh is a very rich businessman. He comes to Amitabh Bachchan, who is an oncologist. So he says, "Ki I've got so much troubles." So basically for GPs and how patients behave. So write me a good medication. The medication which you had given me wasn't strong enough. So write me a good, strong medicine. So he says, "I've run the test. You've got nothing. So you just go play badminton for 1 hour in the morning and evening, take walks and you'll be all right." So he said, "But you are a cancer specialist. So you should give me something." Okay. So that is what, unless until you take out the pathology, nothing is going to work. Iatrogenic, that is the thing. So for laryngitis, vocal nodules, single nodes, they respond well, but not polyps. Okay. So basically, vocal nodules and single nodes are because of overuse. Again, if you give acupuncture but don't continue voice rest, so they won't disappear. Okay. So REN 23, REN 22, stomach 9, stomach 10. Where is stomach 9 and stomach 10? Okay. And LI4, they will help. And hammering over the larynx. So you don't just take any hammer and keep on hammering. कीले ठोकनी है. It is gentle hammering. Okay, so 3-pronged special hammers that you get for acupuncture. Now, another, it's a what do you say, anatomical condition or dysregulated physiological condition, venous disease, but this responds well to acupuncture. So the local points are GB20, SI19, and Sanjao 17. But where is Sanjao 17 and SI19? SI19. Adjacent points are Dumo 20. Distal points are Sanjao 3, kidney 3, UV 23, liver 3, UV 18, and stomach 36. Okay. Any associated nausea or vomiting, remember P6. Insomnia, sedative points, spleen 6. Internal points include your ear point, endocrine, and kidney. Okay, so the disease in the ear, but we are stimulating kidney points here. So remember that. That is why we have the bladder points also. Associated organ of kidney is bladder. Zhang Fu organs, na? What are Zhang organs? What are Fu organs? Fu are hollow organs, Zhang are solid organs. Yin and yang. Which are yin angles? Negative, but and Zhang is yin. Okay. Okay. So you have to stimulate daily for 15 days, then alternate day after gap of months to years. So it will slow down your degeneration of vestibular and cochlear hair cells. So normally we give a treatment for 7 to 15 days, give a break, let the channels re-energize, and then start the treatment again. And then the frequency is reduced depending on the effect for all these conditions. So deafness, again, it is good for acquired deafness, not for congenital deafness. Again, things which cannot be treated, manufacturing defects unfortunately cannot be corrected. So manufacturing defects will remain. Only the acquired defects can be corrected. So we have the Sanjo 17, Sanjo 21, SI 19, and GB2. 1 needle, 2 needles, 3 needles, or 4 needles. यहाँ पे कौन-कौन से पॉइंट्स होते हैं? GB2, so one needle will cover these 3 points, ear points, right? Distal points are Sanjay 3, Sanjay 5, kidney 3, UB23, LI4, GB41. Now, if you see for these group of disorders, the same points are being repeated. Okay, so for a particular group of disorders, it is the same points which have to be stimulated. So you can choose, and depending on the response, what you can do is you can say take 2 or 3 points one day and another set of 2-3 points the other day, which are related on this thing. So that is how you can individualize the therapy and see which is giving the better benefit to the patient, and then continue on those points. Okay. So the ear points are internal ear, kidney, and Shenman. Scalp points, obviously the auditory area. Okay. So this was a study where guinea pigs are exposed to 128 decibels for 10 hours. ठीक है, हमारी कितनी टॉलरेंस होती है? ह्यूमन ईयर की कितनी टॉलरेंस होती है? म्यूजिक सिस्टम का भी फुल वॉल्यूम करके देखा है? सम ऑफ द म्यूजिक सिस्टम शो द वॉल्यूम इन डेसिबल्स. 80 decibels. That is your music system blasting at full volume. That is 80 decibels. Okay, so SI19 was stimulated in half and then all sacrificed. Hair cell damage was found significantly less in the treatment. Okay. Okay. Now coming to the vasospastic conditions. So it is again helpful in Burgers and Raynaud's. It has shown to decrease pain, improve the ischemia time, right? And if started early, you get a very good response. But the condition is again that tobacco and smoking must be stopped. You require strong stimulation and prolonged treatment. We had one patient who had been coming, I think, for 6 to 7 years. Shri Kishan, मुझे उसका नाम भी याद है अभी. He was benefited and he used to come. Every 3 months he used to come. Only needle, because electropuncture, whenever we use electric stimulation, used to have severe pain. So all sir used to do was just put in needles. That's it. Only needle, leaving them for 20 to 30 minutes. Sir, if you remember that patient, he still comes at times for his lower limb pain. So you're muted, sir.
I think the patient's name was Kishan something.
Sorry, sir.
Many times, one of the first things that improve is the claudication. And they will always come and tell you, initially they used to walk to the pain clinic with rests in between from the Panchkunya side gate. And then after a couple of days, they'll come and say that they were able to walk all the way to the clinic without stopping on the way. Carry on, please. Yeah.
So we can give UB23, UB54. UB54 is on the UB54. GB30 and UB54. Sir had only told. UB54 is on the buttocks. Right? UB57, UB60. UB60 is 36, spleen 10, again GB34 for muscle and tendons, and stomach 36. So these are the local points which can be used. Then lung 9 and LI4, ear sympathetic. Now, okay, knee, ankle, and foot, wherever the disorder is, main problem is. Scalp, vasomotor area, upper half, and foot, motor sensory area on the scalp. Vasodilators, however, may have to be continued for continued relief. Raynaud's, acupuncture decreases hypersensitivity to cold and heals ulcers. So, pericardium 6, Sanjay 5. What is so special about these 2 points? P6 and Sanjay 5. Theoretically, practically we don't do it. Through and through कर सकते हैं इसमें, ठीक है? We can go through and through. Okay. LI4 again the most prominent part of, and LI11 on the elbow. Right? We can also give again the same ear adrenal, sympathetic, and endocrine. Scalp vasomotor area and sensory areas on the scalp. Scalp में what was important thing? Left leg में अगर problem है तो कौन से scalp में लगाओगे? Opposite side. Okay. And general anti-allergy points which are LI11, GB34, spleen 19, liver 2, and stomach 36. Again, the primary cause of pathology, you have to remove the inciting event. उसके बिना ठीक नहीं होगा. Now again, there have been reports that myocardial infarction, and arrhythmias can be treated by acupuncture. So arrhythmias, now they say that the idiopathic arrhythmias, they respond best, but not those which are associated with CAD, because you have a pathology here. The pathology is that not adequate blood is being supplied to the endocardium, myocardium, right? So heart 7, P6, stomach 36. These are the points which will help you. UB14 and UB15. So these are the points which might provide you relief with arrhythmias, those who have chronic atrial fibrillation and things like that. Okay, so these stimulation of these points might help. And for bradyarrhythmias, you can use either Moxa, lung 7, or Dumo 25. Okay, you should do mild stimulation and not more than 15 minutes in bradyarrhythmias. Why? Because just putting in the needle might cause a vasovagal. So you might get an exaggerated response. Again, it has shown benefit in hypertension. You have to give us moderate to strong stimulation. So LI11 and stomach 40 combination is good enough for hypertensive patients. Easily accessible points, right? LI11 is on the elbow and stomach 40 is कहाँ पे होता है? Lateral to the middle, almost the middle of the tibia. Okay, you can add heart 3, kidney 3, and UB23 and liver points. Liver 3 is avoided in accelerated hypertension. Right? For associated problems with hypertension, like for headache, you can use GB20 and GB14. Right? For hyperlipidemia, P6 and Dumo20. These are calming and soothing points. क्या theory है? यही बोलते हैं ना, स्ट्रेस ज्यादा लोगे तो ब्लड प्रेशर बढ़ जाएगा. Dyslipidemia is, the stress is considered one of the predisposing factors for dyslipidemia as well, and hypertension also as well. Okay, so that is why the calming points, soothing points, P6 and Dumo20. Again, spleen 6, Dumo20, and stomach 36 for insomnia, and GB8 for vertigo. GB8 is just above the apex of the ear. Okay. Now, ear adrenal is contraindicated in hypertension because ear adrenal is used in your, it will increase the BP. Okay. Now, again, it has been shown benefit in gynecological disorders such as dysmenorrhea. We stimulate for 8 to 10 days and give 6 to 8 cycles. We recently presented our study of a case series of 3 patients with PID who had real benefit with the acupuncture. So we have the 2 groups, stomach 29, stomach 36, and UV 23, and group 2 is spleen 6 and Ren 4. So you use these groups on alternate days. You can use Shinmen on the ear, ovary, endocrine, and uterine points in severe cases. You can even do the scalp genital area stimulation, and spleen 6 in acute cases for pain. Right? So you have these different points. Now, Ren 3 to Ren 5 and stomach 29, 28 and 29 are very good points for your leukorrhea, dysmenorrhea, and pelvic inflammatory diseases along with spleen 6. Even for uterine prolapse in the initial stages, it can be used. So spleen 6, stomach 36, and stomach 29. Now, stomach 29 is one of the common points for your gynecological disorders, right? And Ren 3 to Ren 5. Okay. Pelvic inflammatory disease, you use the back points if you have the radiation of the pain to the back. So UB 31, 32, 33, 34, again Ren 3 to 5, stomach 29, spleen 6. So for these conditions, Ren 3, Ren 4, Ren 5, stomach 29, spleen 6. These are the points which you can start therapy. Okay. And obviously for chronic conditions, ear can be used. Again, sir had talked about malposition of fetus during the second stage of labor. Okay. So there are studies that it can cause the correction of the position. So only moxibustion at UB 67 bilateral 30 to 40 minutes daily. That will help. Okay. You do not try it in contracted pelvis or cephalopelvic dislocation. Painless labor, UB 32 and spleen 14 to stomach 30 bilateral. Where is stomach 30? Where is stomach 30? And spleen 14. So you through and through needling through these 2 points. Okay, for painless labor. Bell's palsy, spontaneous recovery in 3 to 4 weeks. In 80% of the cases, it occurs spontaneously with acupuncture in 95% of the patients. So these are studies which have shown that acupuncture improves the rate of recovery. Sanjao 17, stomach 7, and bilateral LI 4. Okay. So you can use facial muscle points also, GB 14, stomach 2, stomach 3, stomach 6, LI 20, and SI 18. You can use hammering over Sanjao 17. Okay. And you use gentle stimulation in chronic cases. But yes, it has shown to improve. Paraplegia, UB 23, all are bladder channels for paraplegia. UB 23, UB 54, UB 40, UB 57, UB 60, GB 34 for your muscles and tendons. Stomach 36 and spleen 6. So these are the generalized points for all your muscle related problems. Dr. Nitin will be talking more about these points for musculoskeletal problems. For hemiplegia, again, if you see, you have the same points on the affected side. Okay. Now, if atrophy has set in, acupuncture will not. So you have to start as early as possible. So it can be added to your physiotherapy regimen. Okay. So these are the medical disorders. I have omitted out a few. It has been used in infertility. It has been used for failure reflectation. It has been used in other medications for skin psoriasis and other dermatological conditions which have not included. Those are given in the books. Okay, so you have to read about that also. But usually those are the things which won't come to you. Okay, so these are the patients which will come to you. Second part of the lecture will be taken by Dr. Nitin. He'll be talking about musculoskeletal pain disorders, and he is professor at Department of Anesthesia, Lady Harding. Yeah, and just sort out a few technical issues before. Yeah, he's there already in the camera, so. Yeah, just a minute. Okay, so over to Dr. Nitin for the second part now.
Thank you, Dr. Nishant. So for the next topic, we have neurological and musculoskeletal disorders. So what we are actually practicing in our hospital, and most of us are practicing, is not traditional Chinese medicine acupuncture. We are practicing mostly Western medical acupuncture. So it is an adaptation of Chinese acupuncture using our current knowledge of anatomy, physiology, and pathology, and with the principles of evidence-based medicine. So we combine all the things that is from the TCM and the what we know right now, how it functions and works. So you know that this acupuncture works by stimulating the nervous system through either local antidromic axon reflexes, or there is some neuromodulation, okay, or gate control theory, or release of neural mediators, hai na? And central nervous system some effects. So what we now are practicing from Western medical acupuncture. So when we see both the things, Western approaches, basically it is a neurobiological paradigm and somatosensory stimulation. That is the basis of the therapeutic strategies that we will try to accommodate for treatment of our conditions. Now, though we have learned a lot of things, other medical conditions, but mostly if they say 100% acupuncture practice nowadays, mostly it is now limited to the treatment of MSK and pain and neurological pain. And some you may see in newspapers like diabetes and other management also, but most of it is now limited to MSK and neurological pain with very effective results also, as well as postoperative pain and nausea and vomiting. So basically, we don't pay much attention कि क्या point use करना है depending on yin है, yang है, या what it is, there is an excess of chi or a deficiency of chi. We don't go about in diagnosing through the TCM. We diagnose like what we diagnose as what we diagnose right now. It is a chronic osteoarthritis, or low backache, or trigeminal neuralgia, or shoulder pain, and then we formulate our management plan according to the points that we know about from the TCM. Okay, so generally we choose some classical points that best places to stimulate the nervous system for the management of that particular condition. So there is a very large evidence that shows acupuncture to be clinically effective in short term as well as for long term also. So especially when you're planning a therapeutic approach for any condition, we have to have the principles of selection. So what points you will select for any particular condition, that is the most important thing. So for that, as Dr. Nishant was asking you the points, it is the most important thing. Okay, इस area से कौन सा point निकल रहा है ना? So clear idea of the channel path and the distribution of acupuncture points कहाँ है बॉडी में, वो जरूरी है, उसके बिना you can't use it in your practice. Accurate anatomical localization is important to obtain best result in therapy. And उनका accurate localization. So if they are two shown from some landmark and 0.5 shown deep, you have to have that needle into that depth and the distance from that anatomical landmark. So you have to locate the point as accurate as possible, and you have to have a clear idea कि यहाँ से कौन सा channel निकलेगा. So acupuncture points of the channel treat the disease occurring along that channel. That means if you see this point, this is क्या नाम है, lung 7 लिखा हुआ है ना. This lung 7 may be useful in lung conditions because it is a lung channel. It may be also useful because of its location, wrist arthritis. Okay. Lung channel है तो bronchial asthma में भी काम आएगा, rhinitis में भी काम आएगा, and other disorders. So it will treat the disease occurring along the channel. So if that point, maybe it lung, heart, T, but it is at the wrist, it may help in treating the wrist condition, as well as the disease of the corresponding internal organ, like I described you earlier. Okay? So all the acupuncture points treat disease of the local adjacent areas. अभी हमने discuss कर लिया है, ठीक है? So effect on the area immediately surrounding it around 2 to 3 centimeter around that point, उसकी कोई भी condition है. Especially what we are discussing about the MSK condition, neurological condition, any painful condition. Okay, that is the most important key principle when you decide a therapeutic points, AA points हम use करेंगे for that particular condition. And it should be the first consideration that should govern the selection of points for any regional disease. Effect of the local points are mediated by, again, the local reflex arc. Again, the same mechanism of acupuncture, causing changes in the renal microcirculation. So if you see, this is a patient, if you have to have a knee pain treatment, you have to see points like Dubie point, median xian, lateral xian, है ना? Stomach channel. तो ये सारे channels यहाँ से निकल रहे हैं. तो ये हमारे points होंगे जो कि हमारे knee osteoarthritis को pain में हमको help कर सकते हैं. So this is one way of deciding the points for any therapy. Which important things है, if you know that यहाँ तो in the proximal area you have the main nerves. Gradually the nerves branches, they become small nerves and they become a plexus. ठीक है, जितने भी हमारे distal points होते हैं elbow के नीचे और knee के नीचे, they are very useful in treating the proximal disorders. So distal areas are rich in innervation by the complicated network of nerves than the proximal areas of the limbs. So there are a few important points that are 3 in the upper limb, 3 in the lower limb that are very useful for some particular areas of condition, and they have been shown. If you see this diagram, this is a fMRI of a patient in which when you have stimulated LI4, there was an increase in the circulation in the facial area on the brain cortex. तो cerebral cortex में face कहाँ पता है आपको, है ना? Parietal cortex में किस area में, you know. So when we are stimulating LI4, there was some stimulation and increase in the circulation in the cerebral cortex in a fMRI patient. So it has been demonstrated and evidence is there. Okay, so face and special sense organs of front of head and neck. That is why LI4 हम headache के लिए बोलते हैं. LU7 for back of the head and neck, back of chest and lung, and P6 for front chest and upper half of the anterior abdominal wall. So this is how you basically, if you want to choose some points for any condition. And the lower limb points are usually stomach 36 for internal organs of the abdomen, UB40 for low back. UB40 कहाँ होता है? Popliteal crease, but it is very good point for low back, especially radicular pain or even without radiculopathy. We use UB40 for low backache. Okay? And spleen 6. So it is very good for perineum, pelvic organ and external organs, external genitalia. Another important principle is what we require from the therapy. So as you all know, as we have seen our pain forms, patient may have distress, insomnia also because of the chronic pain, है ना? Anxiety भी हो सकती है. So हमको we require, apart from analgesia, sedation, and the body system are haywire. कहते हैं hemostasis खराब है, सब चीज खराब हो गई है, हम उसको ठीक करना चाहते हैं. So we want to regulate the circulation of the chi also through hemostasis and improvement in immune mechanism, anti-inflammatory effects, motor effects, and psychological effects. So these may another important things that require when we are planning for pain management. So at certain acupuncture point, these effects are more pronounced than at other points. So अब जैसे suppose again we will go with the example of knee pain, है ना? Analgesia देना है. So what are the important analgesic points in the body? Again, we will go for LI4. Okay. And in lower limb, we have stomach 44 and stomach 43, knitting and yang. Okay. So you know what stomach 44 is? Lower limb में? Till we'll ask tomorrow. Then sedation. So especially when the patient is very anxious and there is disturbance in the sleep, we choose some points that are DU20 in the vertex of the head, H7. H7 पता है ना? Last. Okay. And UB62. So these are very important and we combined with our pain management, pain points. ठीक है? एक हो गया analgesic point, एक हो गया sedation point, फिर हो गया hemostasis. There are 3 important points that are useful. They have a very complicated neural mechanism. They liberate acetylcholine, adrenaline, serotonin, endorphins, and caffeine, and they basically mediate the homeostasis of the body. So LI11, stomach 36, and SP6. So depending on the accessibility of the patient's body part, you choose any of the 3 points. Then improvement in the immune mechanism. So certain they have a specific stimulating mechanism on the defense mechanism of the body. So we have DU14. DU14 is C7 के just नीचे, है ना? LI11, lateral crease, stomach 36, spleen 6, and they may be very useful when you're treating patients with rheumatoid arthritis. That the patients who have deranged immune mechanisms, rheumatoid arthritis, ankylosing spondylitis, जिसमें कि immune mechanism ही body को खराब कर रहा है. तो अगर आपको immune mechanism ठीक करना है, तो immune mechanism भी ठीक करेंगे, plus hemostasis भी ठीक करेंगे. Then there are painful areas. Suppose सबसे important ये condition हमारे पास आती है जब when we are treating the trapezius myofascial pain. So trapezius myofascial pain has a very specific tender point that are called trigger points. And in Chinese medicine, we say it as a shi point, shi point. Okay, so basically they are areas that become tender in the musculoskeletal disorder. They are basically knots in the muscle that are the reason for pain in this musculoskeletal disorder. And in neurological disorders, we have trigeminal neuralgia. So suppose if you have seen any patients, patient will tell you कि यहाँ पे touch करेंगे and पूरा चेहरा फिर जलने लगता है. So that is a trigger point for that trigeminal neuralgia. If you needle these points, it may help in the management of this. Even in trigeminal neuralgia, it has been found to be beneficial. Then, as earlier has been mentioned, there are certain influential points for certain diseases. For bone and cartilage, we have UB11, and for muscle and tendon, we have GB34. ठीक है? So बाकी भी है, like bone marrow है, but for bone and cartilage, there is osteoarthritis, तो UB11 use करना चाहिए, है ना? और full हो गया है या trapezius myofascial pain है, then you go for GB34 along with other your therapeutic points. ठीक है? So I think knee osteoarthritis is the most commonly studied disease for this acupuncture, and it has found to be a little bit. तो अगर हम बात करते हैं कि कौन कौन से मेरिडियंस निकलते हैं नी के सामने से, तो ये आपको पता होना चाहिए क्या पॉइंट्स चूज करना है. तो आगे से हमारा क्या क्या चैनल्स हैं. तो वी हैव मोस्टली द स्टमक चैनल, है ना. ठीक है, स्टमक, स्प्लीन, गॉल ब्लैडर एंड पीछे यू. So this is how you have to see कि पेशेंट का पेन किस जगह पे है. एंटीरियरली ज्यादा पेनफुल है, medially ज्यादा पेनफुल है, laterally when you palpate the patient, the knee joint, which is the most. So in osteoarthritis, most common is the medial side of the knee. You know? So depending on that, you will choose the which channel is going through that area, and you will choose the points. So now we will go with the local points. What important local points we usually use for knee. So apart from the Rashi point, that are the tender points and the sedation point, we go for extra meridian 31. That is about the from the middle part of the patella. I think the points have been covered. I will just mention, and you just see that this diagram is more important rather than this point. Right? So extra meridian 31, extra meridian 32, stomach 35, median Zian, lateral Zian. Okay. Spleen 9, spleen 10, stomach 34, and UV 40 on the back of the top little piece. So depending the most common osteoarthritis, this is the point selection that we go for local points. Okay. Again, the distal points will be analgesic points or points that are there for the cartilage and other things. One important thing is this spleen 9. Okay, spleen 9 is a very important point when there is most in effusion. So rheumatoid arthritis, lot of effusion. If you use spleen 9, it will try to reduce the effusion in the patient with rheumatoid arthritis. So location again, I will ask you tomorrow. Please be prepared with spleen 9 also. Okay, so you have to have an idea. You know, just as the further slide doesn't have any meaning. The important thing, the local point, the disease you have to diagnose by your conventional method. Choose the point accordingly. Okay, low back kick again, it has found to be very useful. So the सबसे पीछे most point सबसे ज़्यादा क्या होता है? UV channels, है ना? And extra meridian जो है ना? 0.5 should lateral to the midline. Okay. So for the low back ache again, we will go for local points UB 40, UB 60, and LI4 and UB 11. So again, इसमें कुछ नया नहीं है. The same thing what we have learned just before, how to choose the point. This is important when there is a radiculopathy because of the prolapsed disc or sciatica. Apart from the local point that is DU3, DU4, and UB25 and UB26, you can use this GB30. GB30 is exactly the point about the sciatic nerve. So GB30 is just at the point at the sciatic nerve, and it requires a very good stimulation. It is around 6 shun deep. Needle has to be very long needle, and a good stimulation is full in sciatica. Okay. So low back ache alone, because of myofascial pain or because of facet joint arthropathy, you can go for local points. If there is radiculopathy, you can use GB30 along with the local points. Okay. So these are all the points along which the radicular pain usually goes. So if you see the L5 or L4 radiculopathy is the most common, and this is the usual location of L5 radiculopathy, and this will be the L4 radiculopathy. So depending on the radiculopathy, you choose the point. It may be UB40, UB60 if there is L5 radiculopathy. Okay. GB34, K3 and spleen 6. तो K3 हमारा इस तरफ आ जाएगा medial. ठीक है. So depending on the L4 as a radiculopathy, we will go for K3. L5 hai, so we will go for this UB60. So this is how you choose a point according to the clinical condition. The examination will be the most important part. Okay? So heel pain and plantar fasciitis, very good results are there with the acupuncture, and we have avoided steroid or PRP therapy with the help of this acupuncture in heel pain. So the most common points that are there are for plantar. सोल में कौन सा सबसे इम्पोर्टेंट पॉइंट है के किडनी चैनल है ना एंड laterally is the UV channel, okay, and anteriorly is the stomach channel. This is how you try to remember the. You have to remember the channel according to the region that you are going to treat, or you can remember the region, the channel according to the region wise. So we can treat various conditions like sprains and other injuries. And depending on the location, UB60, UB60, K3, UB62, K6, GB40, stomach 41, and spleen 5. So again, the area is the same. These are the local points for any ankle disorder. For Achilles tendinitis, again now we will go for some posterior points. Okay. So apart from archy points and the UB60 and K3 are the permanent points for any ankle or ankle disorder. Okay. We will go for some stomach channel LI4 because this is a problem of the Achilles tendon, musculoskeletal. So we will go for GB34. Okay. So plantar fasciitis, you correctly told about the K1 and K3 point. Kidney 3 is just at this calcaneum border, and very important point for plantar fasciitis. And this is again a very important point for plantar fasciitis. Apart from that, we will use local analgesic point. Now comes our another region that has been explored by acupuncturists is the headaches. So headaches may be tension headache, vascular headache, frontal sinusitis, and other trigeminal neuralgia that have been studied and explored by the acupuncturist. So DU20 has been found to be very useful in all types of headache as well as LI4. If Ashti points are present, they should be precisely needed, and migraine headache respond well to H9. So H9 is a very specific point whoever is having migraine can use for. So again, local points, same mechanism, same theory will occur. So frontal headache. So this is the frontal area. So the points here will be DU23. So DU23, stomach 8, GB14, okay, and extra meridian point 1 is this, just at the labrum. Okay. So these are the points that may be used. Lateral temporal headache, again stomach 8, GB8, so GB8 here, GB8, range of 23, GB34, and distal points that are GB41 and SJ5. Parietal headache, again points, stomach 8 and GB8 will be used. Occipital headache, we will have 20. Okay. GB20 का होता है just to opposite side. Very good. So this is again important. ये भी asked tomorrow. ठीक है, तो पढ़ लेना अभी कि GB20 कहाँ होता है and needling कैसे होती है, ठीक है, and the bladder channels that are there in the posterior part from the neck. So these are the important points for vertex headache. You will mostly have DU20 and extra meridian 6 that are lying along the DU20 channel. This is now, since 3-4 years, this has been a point of, and various nomenclature has been given by various authors that this is not acupuncture, we are doing some dry needling, but everybody knows it is a form of acupuncture on the Ashi points. So needling is, they don't use solid needle. They may use some hollow needle. That is the only difference. The points they are using is only the Ashi points. Okay. But here what we will be doing, we will be using Ashi point as well as the important points on the area, in the local area. Suppose we have to see the maxillary branch. So maxillary branch के वहाँ पे क्या क्या आएगा? जैसे stomach 2 आ रहा है, ठीक है? Stomach 3 आ रहा है, SI 18 आ रहा है, ठीक है? And LI 20 आ रहा है. So these are the common points that are there in the vicinity of the maxillary site, maxillary area that is supplying from the maxillary trigeminal nerve. So apart from the trigger point that is triggering the attack of the trigeminal neuralgia, you can stimulate these points for a very beneficial effect. So again, there is no need to remember all the points. You have to pick and choose 1 or 2 points, start with 2 points and just gradually increase. You should know the area wise क्या points हैं यहाँ पे. या मैं इसको नहीं use कर रहा, आज मैंने ये point use किया. If the patient is coming daily, the same point can't be used daily, है ना? तो आज हमने 2 points ले किए, कल हमने 2 points ले किए, so that we stimulate that area, but we don't stimulate that point again and again. That will be our basically method of choosing. That is why there are so many points for our condition. Similarly, mandibular division, here we will have, अब क्या नीचे आ गए, तो stomach 5 आ गया, stomach 6 आ गया, stomach 4 आ गया, extra meridian 5 आ गया. ठीक है? Local points. Ophthalmic division, GB34, GB2, and the distal points are LI4 and other points. You have to remember the points. है ना? बिना remember किए, there is no use of what we are doing. You know? ठीक है? Shall we move ahead? This is GB4. This is GB14. ठीक है? So apart from this, now we will go back in the back area, that is neck pain. So another very important, neck and shoulder and this trapezius pain. So very commonly that is being treated by this acupuncture. It is neck pain and trapezius myofascial pain. So basically stiffness, torticollis, cervical pain, RA cervical spine can be treated. Again, we will start with GB20, DU14 at C7 and T1, and extra meridian is 0.5 Shun lateral to DU14. So these are the common important points for neck pain. Shoulder pain, depending on the location of the pain. So back pain hai, GB21, SJ15 and other points may be used. SI 15 other, these points may be used. And if there is an anterior pain, then some other points may be used. Okay. You know where is stomach 38? Stomach 38 की क्या important वो होती है, characteristic होती है? This is the most important point for frozen shoulder. ठीक है? तो कल ये वाला point भी याद करके आएंगे. ठीक है? So, ठीक है? So you have the points in the area. ठीक है? LI 15, SI 9, GB 20. ठीक है? These are the most important points. And the distal point is stomach 38. A very strong stimulation. Even if you have read your book, if you put the needle and ask the patient to rotate the shoulder, it is around 50% improvement in the. But usually we get the patient very late, so we can't. My clinical experience doesn't corroborate, but then it is written in the book. Okay. Similarly, elbow pain again. आपको पता है ये सारे पॉइंट्स एल्बो पे हैं, है ना? इंपॉर्टेंट याद कराए सबने बार-बार. LI11 है, H3 है, T3 and lung 5. So very important points for tennis elbow, golfer's elbow, है ना? So elbow, golfer's elbow. So basically the points on the lateral side of the forearm, है ना? Where the common extensor tendon is inserting. Okay. So here you will have LI11 and LI10. Okay. So they lie on the tendon of the common extensor. Okay, that is the cause of your tennis elbow, lateral epicondylitis. Okay. So in summary, this is a summary. I will give you that things. So this is how to plan the points. I will not go in detail in this. It has been found to be okay. Thank you. Any questions?
Better ask questions because you have to answer questions from both.
कोई बात नहीं सर.
I've been to many times. I thought it's only tomorrow.
एक ना स्लाइड हो गई है. ये अनहाइट आपको दिखा सकते हैं. I just want to show you one slide. It is visible.
Again. एक शेयर बंद कर दिया जाता है. शेयर बंद कर दिया. Right.
Palpation. So this slide somehow got hide because of some technical error. So regarding that neurological, so dermatome जहाँ से वो organ originate हो रहा है, so points according to the innervation. So the lung channels, if you stimulate, it may help in C5 neuralgia, C5 disc prolapse. Then that radicular pain is along the lung channel. Okay. So this is just a representative diagram that it may be useful to the practitioners in planning the management therapy. Okay. So the same dermatome, same myotomy pathways of the nerve elected in segmental neurological disorder. Okay. So suppose C5 disc prolapse है, तो जो pain होगा वो जिस dermatome में जाएगा, it may C6, C7, small intestine, C8. Okay. So this is how you can plan your this add-on points for your therapy.
So with this, we have completed our lecture series, and I would like to thank IJCP and MedTalks for their support. Sir, final concluding words, Dr. Kohli.
Am I audible?
Just a minute. We can't hear you. So we can't hear you.
Sorry for the interruption, sir. I can hear Dr. Kohli.
Sir, बेटा एक बार ऑडियो ऑन करना.
Am I audible now?
Yes, sir. Yes, sir.
Very nice presentations and very nicely covered everything. I have just a couple of observations. Nishant, in your slide, I think it was erroneously mentioned that UB23 is spleen black shoe. It is a kidney back shoe.
It is a kidney back.
Yeah, so somewhere it is उसमें slide में spleen black shoe and वही लिखा हुआ था, तो उसको जरा correct कर लो, and since it is recorded that a candidate should not take back a wrong message. Another thing you see in fibrofasciitis, as Nitin has very rightly pointed out, always just palpate the area. Particularly, you will find some small nodules which will help you, and these will be Ashi points themselves. So you don't even need to look for the meridians passing through there. You find a small nodule, you find a tender area, just go for that. And then one point which I want to again emphasize was for vasospastic conditions, don't look for improvement in pulse volume, which will never take place. So claudication, the relief from claudication is the first indication which normally sets in even by the second or the third day of treatment. And it should be continued despite improvement for many weeks, because acupuncture helps in developing what should I say, the angioblast. The activity increases and the new vessels are formed. So not the existing vessels, but the new vasculature will form and improve the blood supply, and will go a long way in preventing ischemic damage to the distal parts. The gangrene and the trophic changes, they can be prevented. Thank you. Rest maybe tomorrow.
Thank you, sir.
Thank you so much, sir. Are there any questions, any doubts? So again, I would request you to please, the outside candidates specifically, if you are coming tomorrow, please let us know on the group. And certificates, unfortunately, will be given only after the course post-test tomorrow. So that
Can I
is.
make one more comment, please?
Sir is saying something. Sir, there's some technical issue I can't hear on my system.
Can you hear me now?
Yes, sir.
I just want to say Nitin has already leaked out the paper for tomorrow.
Yes, sir. That is the practical paper he has leaked out at his station. So there will be around 4 to 5 stations and a theory paper as well.
Okay.
Okay. Thank you. Thank you so much, sir. Thank you so much, sir. So if there are no further questions, we can end the session. So, Nishita, can we end the meeting?
Sure, sir.